Well, I mean, when we do the autologous sling, we're taught that you want a long segment so it will scar in place. But because this is adjustable, you need this part to be mobile. And these are polypropylene sutures so they don't absorb or disappear. And I've gone back years later on patients who've gained or lost a lot of weight and just accessed the barotensor.
And then we had a limited experience, but it's also interesting in patients who have very severe hyperactive detrusor and stress incontinence. And we've done several cases in which we've done Botox and the Remeex.
I know exactly what you're talking about, yes. And I tend to use the Remeex for complex cases. So somebody who has Valsalva voiding, someone who's had multiple slings before, people who might be a candidate for the artificial sphincter, someone that severe. I've had success with the Remeex many times. And I've also had success in virgin implants in patients who have a severe Valsalva voiding issues or a hypotonic bladder who are really worried about emptying.
Yeah. Well, one of our indications are if patients are already operated and we sort of fix urethra, which is very difficult. And you know that you put a second TOT or a TVT after TOT, and you know that they're not going to do well because the urethra is completely fixed.
And so when I do Remeex, I do just about the same thing.
Yeah.
And then I leave it in overnight, and I wake them up the next morning, and I have them empty and cough. I stand them up with a full bladder after keeping them overnight or bringing them into the clinic the next day. And we'll take it out 23 hours after the surgery. Well, another thing is our patients, they may have stress incontinence when they're 49, and then when they're 69, by that point they have a hypotonic bladder, or their body shape has changed, their abdominal musculature has changed. So I love the fact that I can count on being able to readjust in the future with patients. It is part of the AUA guidelines, indicated for recurrent cases and severe ISD where you really need to get your tension right.
Yeah, as you say, there's some long-term data, and I think that the company has recorded repositioning or readjustment.
Have you seen the manufacturing site?
No, actually, no. I would like to. They have to take me.
So I went out, and Francisco Fare is he's the engineer and who runs that site. He's also an MD, and he and his team showed me around the whole place. It was really impressive that everything is done in-house, and the amount of quality control, not just one check, but 3 checks along the line that things are perfect, sterile. The amount of engineering and personal effort that's gone into every step in the processing it really gave me a lot of confidence in Neomedic. And so another thing that gives me a lot of confidence is that the marketing is responsible. So the CEO, Antonio Castello, he's also an MD, not just an MBA. So, on both sides, the engineering side and the business side, there are MDs running the company and making sure that basically every product that is put out is something they want in their family member.